Welcome to Fertile Minds. I'm Dr. Yousif Alyousif, a fertility specialist at Melbourne IVF. Male factor infertility is more common than you might expect, affecting up to 40% of all infertile couples. Today, we are going to talk about the most severe form of male infertility, azoospermia, and explore which treatment options can help these men on their fertility journey. Azoospermia is a condition where there is no sperm present in the ejaculate. This is not uncommon, as 1% of men have azoospermia. To diagnose azoospermia, a semen analysis is carried out. If the result shows evidence of azoospermia, the test is repeated to confirm the diagnosis first, and a portion of sperm is frozen if found. Your fertility specialist will then take a detailed medical history to explore if there is any potential cause of the azoospermia. They may perform a physical examination to evaluate the size of the testes and the presence of the tube that connects the testes to the outside, to determine if the azoospermia is obstructive or non-obstructive. Azoospermia can be caused by blockage or an obstruction, which accounts for 40% of all cases. The good news is, in cases of obstructive azoospermia, most men will be able to produce sperm. On the other hand, non-obstructive azoospermia requires careful evaluation and search for sperm in the testes using a technique known as testicular biopsy. In some cases, this requires the use of a surgical microscope. Azoospermia can be congenital, meaning that a male was born with the condition. For example, due to chromosomal abnormalities such as Klinefelter syndrome. If a male has unfortunately been diagnosed with cancer and undergone chemotherapy or radiotherapy treatment, this can also cause azoospermia. Another common cause is infection, particularly mumps, which can destroy the testicular tissue where sperm is made. If there has been past trauma to the testes, like testicular torsion, for example, this can also lead to non-obstructive azoospermia. One of the first questions that patients ask me is if their lifestyle can cause or affect their diagnosis. Most of the time, lifestyle factors such as diet and smoking are not the cause of azoospermia. However, if you've been taking anabolic steroids, this can stop the testes from forming sperm. If this is the case, we recommend you stop taking steroids, and we can provide you with a medication to restore sperm production. For any lifestyle changes to take effect, it takes time. Sperm usually takes 72 days to form, so it will likely take between 3 to 6 months to see any significant improvement in your sperm production. In cases of non-obstructive azoospermia, we need to carry out chromosomal testing to rule out conditions such as Klinefelter syndrome. You will also have hormonal testing to check your testosterone, FSH, and LH levels. An advanced form of treatment is microdissection, using a surgical microscope to more accurately find sperm and collect a sample, with less damage to the remaining testicular tissue. Sperm that are retrieved can be used fresh on the same day or frozen in liquid nitrogen for future use. This sperm can be used for intracytoplasmic sperm injection, or ICSI for short, whereby the sperm is injected directly into the egg to assist fertilization when their partner undergoes IVF treatment. However, the journey of patients with azoospermia will not stop here. Most of the time, these patients will also have lower testosterone levels, which might subject them to problems in the future. They may require testosterone replacement therapy, which should be done under a specialist care. Thank you for watching. For all things fertility, please feel free to subscribe.